On-the-scene coverage of AHA 13 is supported by Janssen Pharmaceuticals Incorporated.
Well, I'm Chris Cannon on the scene here at AHA 2013 and wanted to give an insight into some of the other programs that are happening here at the AHA. I participated in a terrific program headlined by Gary Gibbons, the director of the NHLBI, that was entitled Looking in the Crystal Ball, the Future of Genetics and Genomics, trying to understand how this will actually play out in the next 10 years as to whether personalized medicine would, in fact, become part of our daily practice. There were terrific reviews of all of the science that has led up, and one of the areas of focus was one of the success stories so far, that is the PCSK9 inhibitors. Now, this has been a very rapid translation from the genetic identification of the gene and a defect therein. Then several years later, Helen Hobbs and colleagues correlated mutations in the gene for PCSK9 with the risk of developing coronary heart disease. This captured everyone's attention to say, wow, could there be a link here? And very rapidly, within a year, there were monoclonal antibodies that many companies had developed and started into clinical development. And I think we've all seen multiple trials of phase 1 and phase 2 dose-ranging studies with monoclonal antibodies so far in the most advanced testing, showing up to 75% reductions in LDL cholesterol sustained over a month-long period or the dosing periods where you're using this on top of statins. These agents have also been used successfully to dramatically lower LDL in patients who are statin intolerant. And we all have many patients like that in our practice, or others that are partially intolerant and really have to be stuck on low doses but still have very high LDLs. And so there are large phase 3 trials now looking at clinical outcomes and huge programs looking at these various statin intolerant or homozygote familial hypercholesterolemia, where the need is huge and the pharmacologic effect in terms of lowering L is enormous. Now, of course, this comes right at a time when the guidelines have said identify risk and treat with high-dose statins as the mainstay. But this program identifies that in the future, not all patients will be at an ideal LDL goal. And if demonstrated with clinical benefit, we'll see an add-on of therapies that will address a big unmet need. And the closing there was the concept of you have statins that can lower LDL by 50%, and these drugs that can take it down another 70 or 75%, we bring LDL levels down to 20, 30, or 40. And so this almost eliminates cholesterol as a risk factor. And so with this very rapid evolution of genetics into large outcomes trials, we may have a real success story of bedside to or bench to bedside with the PCSK9s hopefully impacting patient care. So for On the Scene here at AHA, I'm Chris Cannon.